breasts are like that. And of course, since it's a sphere, like as the radius gets bigger, the best surgery. However, I do think that she was in surgery a fair amount of time, but obviously you guys have heard of Botched. Yeah, move an implant that big, the breast is unrecognizable. I think the narcotics probably still is the most likely culprit. You guys ever watch that show Botched?
Yes.
I have never watched it.
Ever.
I know that does not really line up because I probably should.
I never watch it either.
Okay.
People always ask me if I watch, Grey's Anatomy. And I don't want to watch what my life already is at work.
That is true.
You know what I
That's
mean?
so true.
And plus, they're
so
never
true.
like really accurate, and you're just like the whole time, you're just like, that's not right. That's not right.
Yeah.
I must be miserable to watch those shows,
Yeah.
but so I just don't watch them. But obviously, you guys have heard of Botched, yeah? The
I've
two
heard of
guys,
it, yeah.
Dubrow.
I didn't watch it regularly, but I have seen episodes here and there.
Like Dubrow was like the husband of one of the Real Housewives, I think.
Oh, I don't know any of the people. I like Dr. Pimple Popper.
Pimple Popper, yeah.
Oh,
yeah.
That was fun.
She did Empire for herself.
She did?
Yeah.
She really
Oh,
did,
that's
yeah.
so gross, though.
It is.
Well, I know the Botched guy. I don't know them personally. I have seen clips of them. They actually seem very reasonable to me. You never know with these celebrity doctors, are they really good or are they just, playing the part? I think those guys are pretty good. Well, you guys probably will not have heard, have you heard of the Lip King?
I have not.
Okay.
I haven't either.
I hadn't either, except when I saw the picture, I was like, I've seen that picture before. And
I might be like that.
Yeah, you guys
Yeah.
might be like that. Okay, this is a segment about the Lip King. Jordan Park has died after a botched procedure. He's a 34-year-old from the UK who was on Botched twice. One time asking about his third or fourth nose job. And I think the other time he was asking about liposuction, and they denied him both times. They were like, look, he'd already had at that point dozens of surgery procedures, and they were like, look, you're taking this too far. We recommend you not having any more surgery. And he's like, all right, well, I'm still gonna do it, but I appreciate your honesty. And so he was on there twice, I think 2016, 2019. He's had 50 plus procedures at this point. He spent over $150,000. Some people said he was trying to look like Kim Kardashian. I'm not sure he really
50 plus?
Yeah, 50 plus procedures.
That's crazy.
Yeah. So he's had all these surgeries. Let's throw up. I got some pictures I want to show you guys of this gentleman. So that's him before he started doing all this.
Very good looking dude.
Looks like a normal guy, right?
Definitely.
Yeah, very normal. So that was him, I guess, when he graduated.
Eyebrows look great.
His eyebrows are on point. He's already kind of started a
Very
little bit in the
handsome man.
manicure.
Yeah.
All right, let's go on to the last. This is in the past year. These pictures. I almost thought this was AI when I started seeing.
Yeah, it looks like a filter.
I was
a
like-
Snapchat beauty filter.
I was like, is this AI? But then I kept seeing pictures in different places, and they all kind of look the same. And these were on news websites. So I think these are kind of accurate of what he is kind of looking like now, or was looking like. So yeah, I 100% agree with the Botched guys. If this person came in wanting surgery from me, I'd be like, absolutely not. At the point that you're having that many procedures, it's just unhealthy. It's never enough.
It's really sad.
It is sad. It's very sad. Well, it gets even sadder, and then it gets weird. So last week he died in the UK.
How old is he again?
34. Wow. 34 years old. So he died. The details are a bit sketchy, but from the news articles that I found, it said that he died after a cosmetic procedure, and it was reported that he had a non-surgical BBL, also known as a liquid BBL. Now, I know you weren't. Brena, were you here when we talked about the liquid BBL?
Yeah, I think so.
Okay.
Yeah.
So I'll get Kalee and whoever might be watching up to speed. So first off, I do not like surgery BBLs. They are very risky. And so there's been a new procedure developed called the liquid BBL. I think I called it the non-surgical BBL. And basically it uses a product called Sculptra, which is a filler.
I've heard of that. I've heard of Sculptra.
I like Sculptra a lot. So Sculptra is a filler, but instead of it just creating a space which changes the shape, when you inject this, it actually causes collagen formation. So it's not the fill of the liquid that is giving the result. It's the fact that the product you're injecting, which is actually liquid Vicryl. So Vicryl is a dissolvable stitch that I use in surgery literally every day. This is a liquid version of that. And when you inject it into the tissues, it causes collagen formation. And I mean, I know a lot of people have done this. It's nice. It gives good results. I think it's a good treatment, like when you get into your 40s to 50s, where you're starting to get some laxity of the face. You know, it can give you some tightening, almost like a really good laser treatment, but it's doing by different methods. So you can stack it with lasers if you want. Again, this is how I think a lot of these celebrities look so young without having major surgery. But so we did a segment on this liquid BBL. I think I call it the non-surgical BBL. And I have to say that I was pretty impressed with the results. You know, I thought that the befores and afters looked good. I also, one concern I had was the cost, because Sculptra is expensive. And it takes a lot of vials to inject into the buttocks to get it to give you the result that you want. And I'm going to throw a number out there. I don't remember exactly. I want to say it was like over $20,000 in product to get the result that you want. It was pretty expensive. And I was like, I actually don't hate this. I just worry about the cost. And at the time, I looked at the risk profile, and I didn't really see anything pop up that made it look like it was overly risky. So fast forward to today. So this gentleman, Jordan Park, the Lip King, apparently died after one of these procedures. 2 people were arrested for their involvement in this, which I don't know if they just arrested him because he died, or if they thought that something bad happened, meaning they did something that was, you know, illegal.
Negligence? Or...
Yeah, I don't know. Like, this is just happened, and the details are kind of sketchy. But it gets even crazier from there. So Jordan Park was an esthetician. They called them beauticians, I think, in the UK, but to me, a beautician is like somebody who does makeup. An esthetician is somebody who does like Botox, fillers, that type of stuff. And although they called him a beautician, it sounds like he was what we in the United States would call an esthetician, because he does do injections. And in 2024, he was arrested when a patient of his died from a liquid BBL. Yeah, a 33-year-old named Alice Webb died after the liquid BBL. So he was actually out on bail when all this went down.
So what could cause someone to die?
Yeah, that is a really
procedure?
good question. And Sculptra is very safe. It has a impeccable safety profile in the face. And so I would say, and I'm going to like do some research on this. I was just kind of getting this story together, you know, and I didn't do the deep dive that I probably should have, because I thought I'll just probably make a whole nother segment out of this, you know, in the future. I would assume that the cause of death is probably the same as what causes deaths in like surgical BBLs, which is when a material gets into the bloodstream. I'm going to guess, because like what kills people with Brazilian butt lift is there's very large blood vessels in the butt. You're injecting fat, which is in like very fine particles. And if the needle that you're injecting with gets into a blood vessel and you load a big shot, or not even a big shot, like some fat into that blood vessel, and it gets into your bloodstream, it basically causes cardiovascular collapse. It causes this kind of cascading reaction, which it's a little kind of weird, because you wouldn't necessarily think, you think it might just be like a blood clot, but it's not. It causes a much more severe reaction, and you know, it's very life-threatening, and that's the major thing that causes death with Brazilian butt lifts, the surgical version. I would guess it's the same. I imagine if you get liquid Vicryl into your bloodstream, you could very likely get a similar reaction to if you get fat in your bloodstream. But I'm gonna have to like nail that down exactly, because when I know when I did the segment on the non-surgical BBL and we were talking about the Sculptra, I don't remember there being anything. It was like, okay, it's just Sculptra. Like, this is very, very safe. We do it. Sculptra's been around for 20 years. Like, it's not a new product. It's got a little bit of buzz lately. Like, I remember doing it back when I was a fellow in the mid-2000s, and I was like, yeah, this stuff's pretty good. And then I got here in Dallas and started my practice, and it just wasn't a thing around here. Nobody asked for it, and so I didn't even, you know, look into using it. But then all of a sudden, it kind of like emerged here. And I do like it. It's a good product. But But yeah, I mean, I think that there's a lot to unpack here. I mean, the poor guy, as we mentioned, I just really feel bad when somebody obviously has like some sort of issue where they're not going to stop having surgery and people enable them.
Yeah.
You know, it's almost like enabling an alcoholic or a drug user to me. You know, I mean, it's borderline. I don't even know if it's borderline. I think it's like unethical.
Yeah.
You know, like, because the Botched guys were talking to him about, look, you can't get any more filler in your lip. Like, your lips are going to die. And he's like, I know, it's risky. And then he started having complications with his lips. Like, the filler started just, like, coming out because they just were, like, I mean, we saw the picture, like, his lips were enormous.
I just don't know how you, like, live like that either.
Yeah, see, I mean, look at that. That's just insane.
Yeah, it looks unreal.
Yeah, it's almost like a cartoon character.
Mm-hmm. The lips are like the first thing that I saw, like the top lip especially.
Yeah, I mean, it almost touches his nose.
Yeah.
So I think that's kind of like one of the take homes here is, you know, I think that he was failed by the system and, you know, by surgeons and estheticians. I mean, I would imagine a lot of the procedures, like the non-surgical stuff, were probably done by people he knew, you know.
Yeah.
Because when he got arrested for that girl's death, like he wasn't the only one. There was one other that got arrested, and so I would assume that, you know, it's a lot of people he knows that he's, you know, getting to do these procedures. But then he had, you know, after he saw the Botched guys, allegedly he had like 4 nose jobs. Like, I mean,
I don't really understand that.
yeah, I mean, that is a thing where not a lot of people, but some people they'll get a nose job and like it'll look good. And they're like, well, I just want it to change a little bit, and then they do that. They're like, well, I want it thinner, you know. And you know, the risks start to mount up. The more that you start shaving away the cartilage of the nose and the framework, the more likely it is just collapse. I mean, that's like the Michael Jackson, you know, thing. Remember when his nose looked just so bad because he had so much surgery, and then just the structural components just completely collapsed, and then he had that kind of, you know, that kind of defect there. So I think that's one thing. You know, unfortunately, he needed somebody to tell him no, and maybe there were some people along the way, but not enough.
He still found a way.
Huh?
He still found a way.
Yeah, he found a way to get it done. Yeah, it's just kind of like, you know, the drug users, like, you know, they find a way to get what they want. You know, I think another one is, you know, about the liquid BBL. I think we'll have to definitely retouch on that. I did like the results of that non-surgical BBL. I thought it looked pretty good. It's a little bit different than the classic BBL because, you know, the classic BBL, the surgical version, you're basically filling it full of fat, you know, to make it round. Like this kind of like tightens it and lifts it, so it's kind of a little more athletic look almost.
Yeah.
So I thought it looked pretty good. I mean, honestly, I don't hate the appearance of Brazilian butt lifts. You know, because, you know, you see them, I don't know if you guys probably don't see a lot of plastic surgery on your feeds, but I do. And so I'm constantly seeing BBLs pop up, and I'm like, yeah, honestly, it doesn't look bad. I mean, thank God they're still alive.
Yeah.
And who knows what it's going to look like in 6 months, but I mean, initially it looks pretty good. But the sculpture ones I thought look pretty nice. So we're going to definitely touch base on that one again. And then lastly, you know, I think the UK probably needs to have a little bit more regulation on who's doing what.
Agreed.
Are they pretty lax?
I think they are. I don't know exactly, but I know that there was somebody, some lawmaker was quoted in one of the articles I read saying, see, this is what happened. We asked for there to be more regulation, and now this person has died from this liquid BBL. You know, I mean, who knows? They may just be doing it just to, you know, make a name for themselves. But it is, I know in the United States that it is very lax depending on state. Like certain states are the Wild West. Like Florida is the Wild West. Texas is a close second. Like it's pretty crazy what people can do here. And then in other states, it's a lot more regulated. You know, I think there's a balance because I mean, I remember one time we did a segment, some politician was talking about, well, only a physician should be able to inject. Or no, what they said is, if you have a med spa, no one can get a procedure unless the medical director does a consult with them. Which, I mean, to like the layperson, that sounds, okay, doesn't sound unreasonable. Well, I mean, for a lot of these things, like hydrofacials or simple Botox, or even like, you know, basic fillers, you don't need a doctor to do it. If you got a good esthetician, they can definitely do it. And so what'll end up happening, I mean, It actually would probably put a strain on my med spa. You know, I'm
Yeah.
not sure I could see every patient. We'd have to like pick a day and stack it up. And what happens, a lot of places would go out of business, then costs would go up.
Yeah.
You know, because I'd have to cut out time out of my other stuff to do that. And then, you know, you have to kind of make up that loss of income. I think there's definitely a balance.
Yeah.
You know, the
Yeah.
Wild West is not great, but, you know, over restriction's not great. And I don't know, it's still hard to find that sweet spot in it.
That's just too bad, though.
Yeah, it's
That's
sad.
sad.
Now's the big one, and I mean the big one. All right, so this is, thanks to your team, Kalee, Chip, for giving us the heads up on this one, because I hadn't seen this one. So we are going to do a segment on the largest breast implants in America, allegedly. We have a video, and me and Kalee and Brena are going to react to this. I tried not to like listen to it. I did have to clip it. So, wow, look at that. Before we even get into the video, look
I
what's
couldn't stop watching.
Look what's going on there. It's so crazy. Okay, all right, you ready to roll that?
I just watched because I really wanted to know if this
Now,
was AI or real.
should we leave our mics on so we can comment
Yes.
midstream? All right, so
Let's do it.
all right, let's leave all our mics on. All right, let's go. Ready? Roll it.
I do have the largest breast implants in America. There you go. Oh, and I
Dude,
have
look at her.
the second largest in the world.
I mean,
For the past 8 years, Foxy has been obsessed
I-
with extremely large breast implants. She has made it
There
part
are
of her
some that
emotional
look
coping
real, some
mechanism. Foxy says that
video.
8 years ago, she
looks
went
like a
through a
cartoon.
divorce, lost her
But
job,
half
and her
looks
grandfather
fake.
passed away. She felt that her life
Like
had
her body
completely
looks
hit
fake
rock
with those
bottom.
big breasts.
Whenever she felt sad,
Yeah.
anxious, or
She looks
wanted
like
to
a-
regain herself,
a
she would
cartoon
rely on
character.
continually
Yeah,
enlarging
like
her
a
breasts
Jessica
to
Rabbit,
feel better.
except-
Foxy says she started with a
Look
CPAP.
how low they
She has
hang.
had
They're
4
like-
breast
they're
augmentation
resting, like, on her
surgeries in
knees
total.
almost.
That looks
She has also
painful,
had
yeah.
body
Yeah.
implants, facelifts, rhinoplasty, and more than 10 other cosmetic procedures. She now has the largest breasts in the
Oh
United
my
States. Each implant is 940 cc,
Okay, so that's
making
not
her
correct.
breasts the
940
second largest in
cc's.
the
That's,
world.
I think they
Now,
mean
when I look in a
9,000
mirror, I feel
cc's.
super sexy because I love the exaggerated curves.
no.
I love what
She's
I've
got,
done.
like, serious
I
body
don't want
dysmorphic
to stop
disorder.
yet. I am obsessed with surgery, but at the end of the day, I'm still the same person under all of the saline.
Oh, saline.
She even
I
hides
was like,
saline at
saline.
home and injects it herself. Watching her breasts grow bit by bit gives her
no
an
way.
addictive thrill.
Oh my
She
God.
wants to
Herself?
reach 10,000 cc to break the world record. Even if she bumps
The
into things when
world
going
record.
out, can't breathe properly while
her.
exercising,
Oh,
or
that's
can't
real.
buckle a
That's
seatbelt,
100%
she doesn't care at all.
It looks like she
wasn't
can't even,
until
like,
her
get up when
family
she
and
falls
coach
over.
noticed her behavior that they forced her to learn about the risks. Doctors warned that a wrong injection or too much filler could rupture the breasts and directly cause death.
That wouldn't
But
happen.
even knowing her life
She
would
would
be in
die if they
danger,
ruptured.
Foxy doesn't see it as harm. She still wants bigger breasts. She still wants to claim the world's #1 title.
Well, at least she has goals.
Wow. I have a lot to say on that.
Okay, lead us off, Brena. What do you got to say?
God.
Tell me.
Are they high maintenance? Like, is she gonna have to like, I don't know, to keep them that full? And
I mean-
like, there's no way the support.
Okay, so
I feel like it would rip. I don't
feel
know.
like before my
That's a
breast
big risk.
reduction, I had very large breasts, and they hurt, and
Yeah.
they were like an ant compared to that.
Yeah, right? Yeah, those are all.
Like your back would hurt really bad.
Yes.
Number one. My question was, did she put more in her booty to help balance it out so
you
that
almost
she
would
didn't
have
fall
to.
forward?
You need like a counterweight
Yes.
back there. To,
I'm thinking
like,
we
keep
need
them
something
just-
back there.
to just like not just fall over. I mean,
Like how does she stand upright?
she doesn't. Like to me, that's probably my,
Because she was taking pictures on the street.
I have a lot of problems with what's going down there, a laundry list, but I'll jump to what you said. I mean, yeah, like that's really, really bad for your back. Like you're gonna have like chronic back problems, from having breasts that large.
Yeah.
I mean, anyone who's had breast reductions will tell you that when the breasts get that large and if they're hanging like that, like it's a real strain.
Yeah.
And like over time, like that does like permanent damage. Like you start to get like just basically the cushion part of your spine, like both in your neck and your back, will start to get worn out because there's
Like
so much strain.
cartilage.
Yeah, yes. And so I mean, she's basically potentially harming herself long term as far as like her posture and back pain and all that with having something that big. I mean, it's just literally insane. And when they said 900 cc's, that's wrong. Those are I think they meant 9,000.
Well, yeah, because her goal is 10,000.
Yeah,
So if
because-
we have to go that far, then we.
Yeah, no, because 900 cc's, I mean, that's super big, and I'll talk about like what I'm willing to do with implants. But 900, although is very, very big, is not anywhere close to that big. You know, a 900 cc implant would be about probably like this. You know, and her breasts are like that. And of course, you know, since it's a sphere, like as the radius gets bigger, the volume jumps up by, you know, 4
Like, I don't
times.
know how your skin doesn't rip.
Right, and that's the other issue is because I actually have kind of an interesting story about enormous implants. It's been probably, I think it was before COVID, so maybe 6 or 7 years ago, I got a call from one of the hospitals, and there was a lady that was trying to do something similar to this woman to get like these enormous implants. And what happened is they were so big, it stretched her skin out so much that her skin started to die. And so her implants were $3,500 each.
Like, what? How big is that? Like, I need
So
visuals.
3,500 is probably something about like this, you know. I
Like
mean,
next to each other, though. So they're
yeah,
like,
so like I'm just like saying, you know, like if you had like a 3,500 cc, and probably more like that. I mean, it's pretty good size. You know, maybe like bowling ball sized. You know, it's like almost 2 2-liter Cokes if you compact them into a ball. Does that help?
It does, but
Okay.
I just can't. Like, I am one when we do this podcast and we sit next to each other and we look at things. I'm very much like, I don't want to make anyone feel like, okay, what they're doing is like bad. But this is
Sometimes
really bad.
people need tough love, man.
But this is really
this
bad.
is really bad, right? Well, you know, and who's doing this to her?
And like the doctor, well, you said, let me ask you this, because I was thinking in my head, could these burst? And you were saying like that's not true, like it wouldn't cause imminent death.
It would not cause, because, well, as long as they're using saline implants, saline is IV fluid.
Okay.
And so...
So she's just staying hydrated.
Right, yeah. If they pop, she'd have to run to the bathroom and go pee in like 5 minutes because like suddenly her system would be
I'm sorry.
absorbing
Yeah.
10 liters of IV fluid.
So this is the way. Just don't
No,
do like the IV membership. You could just.
Yeah, no, she would die if they ruptured, but that saline would get absorbed, you know, pretty quickly. You know, because again, saline's IV fluid. It's basically the liquid part of your blood. You know.
She probably has more saline than water in her body.
Right. Yeah, probably so. I mean, although I don't know. I think
Do they
people,
float?
No, I think because they're saline, they would be slightly denser than.
Yeah, she
fresh
had to like
water.
lift them a lot. So,
Yeah, and
I
so,
can't believe she even goes to the gym.
yeah,
I
I was
know.
shocked to
Like,
see
she
that
was
part.
like on her back. She looked like a turtle that had gotten put on its shell. She couldn't get up.
We also
Like,
have a comment.
Oh yeah. What's that?
Cindy, she said, "How is she injecting more saline at home without causing leaks or ruptures of the implant?"
So if that's true, then there
That's a
are
good
certain
question.
implants
Yeah.
that have like a port. Now these are not things that they have in the United States, which brings up the question of did she have these in the United States? I doubt she did. I just.
It did sound like it was not from the United
Yeah,
States. Like the story.
It would be hard for me because in the United States, you know, if somebody wants to get implants that big, you have to buy the saline implants from out of the country because the saline implants in the United States are capped, I think somewhere around 1,000. I mean, hardly anyone uses saline implants anymore. So, you know. So she probably got them outside the United States. When that one lady that I took care of, where I had to remove the 3,500, which by the way is a total catastrophe. When you remove an implant that big, the breast is unrecognizable. It's
Like,
just,
what do you do then? Like, what did you?
I mean, what
did you do anything or?
I told her like I didn't want to jump on the grenade, and I was like, look, I'll take out your implant because your skin's rotting off, and I'm gonna like put a drain in and close you up. But you need to go back to your surgeon that did this to you. And she was telling me that there's like only 2 surgeons in the United States that will do these like crazy, insane, large augmentations. Like she had 3,500 and she was trying to go bigger. And she was telling me she was gonna have to go out of the country because the 2, one was in Los Angeles and one was somewhere weird like Utah or Denver or something. Like they were kind of capped out at what they would do. So I don't think that someone in the United States gave her 9,000. I don't think so.
So what's the largest you would do?
So
'Cause you said earlier that
Yeah.
you-
So the absolute largest I would do would be 800 cc's. That's it.
And what would that be?
So 800 is probably about like this. I mean, it's really big because you think.
You remember that video that we shot where we threw them at you and you were blindfolded and you had to tell us?
Yeah, so we were
Which
doing,
one?
so those are like 400, 500.
Okay.
Like my
'Cause there were some big ones.
My preference for cosmetic. Now for reconstruction, it's a bit different. You can use. I'll use like up to like 11 or 1,200. But remember, those patients have no breast tissue, right? So with no breast tissue, that much volume gets swallowed up pretty quickly, and you'll need that to match them up to what
if they do have tissue? I'm sorry, I have random questions.
So that's the difference between, you know, a reconstruction where they have a mastectomy and all the tissue's gone, or cosmetic where they do have tissue, right? So if they do have breast tissue, like we're just doing a regular breast augmentation, I mean, I've done 800 a time or two, but I try to talk patients out of not going that big. And it's usually when they're swapping from like a 700 to an 800. They already have something big and they're like, look, I just want to be a little bit bigger. And I'm like, okay, well, 800 is the max. Like, I don't know, you know, I give my spiel about, you know, as they get bigger, you're more likely to want to take them out sooner. You know, you can have issues. And I don't commonly do implants over 500.
I wonder if she's
maybe
single.
Once a year. Huh?
Like if she's single or if she's married, because like I don't think anyone else can sleep in a bed with you.
Yeah, I don't even know how she sleeps. I mean, because those things are heavy. I mean, if they're 9,000 cc's, let's see.
Oh, that's a good question. How much does that weigh?
It's about 10 pounds per gallon, which is what, 3.4 liters. So it's probably 30 pounds per side. So there's like 60 pounds of weight on her chest. Yeah, it's like a ton, right?
That is wild. I don't know how you live like that.
Yeah, it's crazy.
I would just be complaining every day, all day.
Yeah, and she's still trying to go bigger.
I don't like to be uncomfortable.
I feel bad for her because I mean,
too.
She's obviously got some, you know, some mental issues with this. I mean, I don't think any kind of well person would look at that and be like, I want to go bigger, I want to go bigger. Like there's something going on. And then I feel bad that someone's taking advantage of her and saying that they'll do surgery on her.
But my question here is it legal to allow someone at home to have saline to inject themselves with? Because they said that in the story, she has saline at home to inject.
It's probably not illegal, although you would probably run into like, you know, malpractice type issues if you did that. Like I would never let a patient inject themselves, you know. I've used expanders that had ports before, but more for like reconstruction, but I would never let the patient access them, you know.
Yeah, that's like my question. Like that was part of their story. Like they didn't even like beat around the bush. They were like,
yeah, I don't know.
Saline at home, and she injects herself.
There are implants out there that you can do that, and if she was shown how to do it, it is believable that she might be doing it, but I mean, you know, that's not good. That's why, again, I can't imagine she had this done in the United States. I mean, it just, I don't know. I would argue that what's happened to her is malpractice, and that you could go after the surgeon that did it, or you know, potentially sanction it, like board sanction them.
I can't believe that plastic surgeon allowed himself in that video.
I don't think he's the one that did it.
Well, you know, but like, keep me away from that.
I know, right? Like guilt by association. Yeah. And this one is out of Ohio. And this is about the popular TikToker Rachel Tussey, who just recently died after having a mommy makeover. And the situation of it's kind of just unusual, or not the usual kind of thing you see when somebody has a really bad outcome. So we were just gonna kind of go over this and see, maybe, you know, can we figure out what happened to her? Did you see this? She was all over social media.
Yes, I did.
Oh, I think you actually sent me this one, but I'd already saved it. Like when it popped up, I was like, oh, we should probably talk about this. Yeah. All right, so Rachel Tussey was a 47-year-old wife and mother who also was a TikToker. I hadn't seen her on TikTok before all this went down, but she did have a fair amount of followers. And she was basically documenting her journey with plastic surgery, which is kind of a popular thing these days, where people are like, oh, I think I'm gonna have surgery. This is where I'm looking for doctors. This is how I'm preparing. And I went and actually looked at all her videos, you know, after the fact, and she did a pretty good journey, a pretty good representation of her journey in this whole plastic surgery endeavor. And it was really sad because she even made a TikTok literally right before she was about to go into surgery. And it was kind of hard to watch because she's like, I'm so excited, and you know, I'm starting my new life and all this, and yeah, it was actually pretty sad to watch. So she did go to a legit plastic surgeon. That's the first thing I always want to know when people, you know, have some sort of problem with surgery. Is, okay, was this person properly trained? It was Dr. Torque out of Cincinnati. I mean, I looked at him, he looks totally legit, good training. You know,
not Miami, not out of the country.
That's right.
Green
Yeah.
flags.
Yeah, and speaking of that, I've had two doctors call me in the last week about patients who went to Mexico that are having
goodness.
problems. Yeah, I
Ugh.
don't know the details. I haven't seen them yet, but yeah. All right, so she went to this very legit doctor, Dr. Torque, for a mommy makeover. It wasn't exactly stated what she had, although I'll talk about that in a minute. And as I said, she did post a video right before she went in saying that she was going into surgery. And then she didn't post anything for like a week. And then a week later, her husband made a post on her account. I don't know if you saw that one, Brena. And he basically recounted the story of what happened to her. And at the time, she was at the hospital, not the place where she had surgery. This was like a full-on hospital. And she was in the ICU, like on a ventilator. And they basically told her husband that she was brain dead. Mm-hmm. And so he started, talking about what happened to her. And so I obviously very sad, situation here, but I always want to know what happened, not only because I want to avoid that for my patients, but also as like a learning tool for people. Like, is there something that happened that could be avoided so that someone in the future doesn't have a similar occurrence? And so, the first thing that I wanted to know is what procedures she had done, because as we've talked about on this show many, many times, the number one surgery for causing death in plastic surgery is Brazilian butt lift. Mm-hmm. And so, when I looked at the articles on this, it said she had a mommy makeover. Now, you've heard of that term, right, Brenda? Mm-hmm. Mommy makeover. Okay, so mommy makeover to me, as a plastic surgeon who does this for a living, means that you're having your tummy done, like a mm-hmm. tummy tuck. And generally it means something done with your breast, but that's kind of non-specific. It could be a breast lift, a breast augmentation, a combination of the two, a breast reduction. Typically, mommy makeover means you're having tummy and breast done, but not always. I mean, it could mean that you're just having multiple surgeries at once. And I looked through tons of articles. I even went through all her TikToks because I was trying to figure out what exactly did she have. And the only thing I know for sure is that she had a tummy tuck and she had liposuction. So, I mean, that gives you a little bit of information. As I said, I was really curious if she'd had a Brazilian butt lift, but I couldn't find that, but I don't know for sure exactly what she had. And then the next thing I kind of want to know when there's a bad outcome is how long was she in surgery? There's definitely a difference between being in surgery, 4 hours versus 12 hours. And there was no indication of how long she was in surgery. However, I do think that she was in surgery a fair amount of time, because when her husband made the post, it mentioned that the surgery center was basically closed whenever they finished her surgery. Meaning
Interesting.
I
didn't see that part.
Yeah, so it was a very subtle thing. He just mentioned like everybody was gone.
Yeah.
And so to me that indicates that it was the very end of the day. Like the surgery center I work at, they really like you to be done with surgery around 3 o'clock.
That makes sense.
Although it's really, because cases start at 7, so it's like, okay, 7 to 3, 8 hours. But it's very common that surgeries will go a little bit later. But by 5 o'clock, it is pretty dead in there. And so, meaning, people that aren't needed go home, right? So I'm assuming, based on what he said, that the surgery went late. Now, that could mean that she had an all-day surgery that ran super long, or it could mean that they just started her case late. We don't know. So I don't really know how long her case went. But there was one kind of important thing that he mentioned, and he said that after the surgery, the surgeon came out and said, hey, everything went great, she's in recovery. Okay, that's a good sign, right? That wasn't something that happened in surgery, and he's like, oh man, this went really bad.
Yeah.
So the surgeon came out, said she did great. You can, go back and see her. The surgeon left, which is very normal. Some people were questioning, why did the surgeon leave? Well, that's like routine. Like you do the surgery, the patient gets to the PACU, which is the recovery area, and if they're doing okay, you leave. Because a lot of times it's not the only surgery you have in the day. You're leaving to go do other stuff.
And if it's at the end of the day, it makes sense.
Yeah, I mean, and it's just not typical because, the chances that somebody's going to have some issue if they're in recovery and awake is it's not 0, but it's pretty darn close. Mm-hmm. So the surgeon left. He went back to see her. She was talking, heard his voice. he went to talk to her, and then here comes the kind of the information that was a little bit, pertinent. He said that the nurse gave her 0.5 milligrams of Dilaudid, which is a narcotic medication similar to morphine but stronger, and then 150 micrograms of fentanyl, which, as we know, fentanyl is a very strong narcotic pain reliever. And shortly after that, she became unresponsive. She went from being awake to being unconscious, and apparently she wasn't breathing, and the nurses tried to put a bag mask on her to give her oxygen, but he said that that wasn't going very well. And then the nurse kind of left to go call the surgeon, who, as I said, had already left the building. She came back. It wasn't exactly clear what they did from there. The surgeon shows up and immediately kind of assesses the situation and says, okay, this is not good. We need to call 911 like right now. So they called 911, EMS arrives, they get her in the ambulance, they take her to the local hospital, and from there, the details get a bit sketchy, but she was put on a breathing machine. They ran a bunch of tests, and within 5 to 6 days came to the conclusion that she was brain dead.
That's awful.
And yeah, terrible.
Man.
And he said that someone told him that she went without oxygen for at least 6 minutes.
Oh my gosh.
So there's a lot of information there to kind of parse through. Oh, by the way, there was one thing that I didn't mention. The nurse did give her Narcan. So Narcan is the drug that you give to people if they're ODing on narcotics. Because as you may or may not know, Brena, or the listeners, one of the things that narcotics does is it can depress your respiratory drive. It can make you unconscious, and you basically just suffocate to death. And so they gave her Narcan, but they said that it didn't do anything. They gave her the Narcan, she didn't wake up. All right, so we got a lot to unpack there to try to figure out what happened to this poor lady. So the first thing that is notable is they gave her all these pain medications, right? And I'm sure you listening to those numbers and the names of the drugs are like, okay, that means absolutely nothing to me. Even myself, I had to kind of like dig into it a bit because I never give fentanyl. I've given Dilaudid to patients. I've given morphine to patients, even when I was doing critical care stuff and we have to do procedures. And so I have a really good idea in like dosages of morphine, what's kind of a normal dose, a high dose, and a dangerous dose. With fentanyl, I didn't. So I actually called one of my anesthesia friends because they use fentanyl all the time, and I said, look, if you had a patient that came out of the OR and you gave them 150 micrograms of fentanyl and a half a milligram of Dilaudid, is that a lot? And he's like, no, that's actually a pretty normal dose. Because everybody online was saying, oh, they gave her too much narcotic, and that's why she basically went into cardiac arrest. And so I kind of thought that was a high dose, but my anesthesia friend said, no, that's actually really normal. It's basically the equivalent of giving around 17 milligrams of morphine, which when I put it in those numbers, I mean, that's a high dose of morphine, but not a deadly dose. I've given more than that to patients that are, in an ICU setting. So, on the face, that amount of narcotic typically would not be enough to put someone into a situation like she was in, where she was unresponsive and not breathing. Also,
Interesting, because I feel like that would be like the first sign of like, oh, that could be definitely where it came from.
And that's what everyone online was saying. Everyone online, and of course this is just comments, right? People like talking and like, oh, they gave her too much this, too much that.
Yeah, theories.
Yeah, just theories. And and they gave her the Narcan, which didn't reverse it. However, the timing of that is everything, because if you give somebody, if say you give somebody 1,000 micrograms of fentanyl, which would be a lethal dose, and you give them Narcan immediately, it's going to reverse it, and they may or may not be okay. However, if you give them that massive dose of narcotics, and then they basically stop breathing, and enough time goes by that they get like an injury to their brain, they're not going to wake up. And so the fact that they gave her Narcan and she didn't wake up, I mean, It's important if they gave it right after they gave the medicine, like, oops, we gave too much and we give the Narcan and it didn't work. You're like, okay, something else is going on. But if, like, say, 6 or 7 minutes went by before they gave the Narcan, she could have had a brain injury, in which case she's not going to wake up anyway. So the Narcan is kind of like notable, but it doesn't really explain anything. Also, the dosage that they gave her is not a crazy high dose. I mean, there'll probably be people out there that say, oh, that is a lot. I mean, it's not like a little amount, but I mean, straight from an anesthesiologist I know that is very, very skilled, he's like, no, that's a normal amount. We give that stuff all the time. So, what could have happened to her is kind of like my question. And I do think that given the circumstances, they'll do an autopsy and they're going to figure this out.
Right.
But you always like to kind of know, okay, do we know what happened here? I mean,
yeah. And did she? I can't remember if you mentioned. Did she have any work done before, or was this like her first?
Not that anyone mentioned.
Okay, because that's what I was also wondering.
Yeah. Nobody mentioned that she'd had any work done. She didn't mention she had any work done. Again, we don't know exactly what she had done outside of we know she had a tummy tuck and we know she had liposuction. I mean, that is one of the most routine procedures I do. I did basically 3 tummy tucks this week.
Yeah.
I mean, there are a little bit bigger surgery for like a cosmetic or aesthetic surgery, but they are very, very safe. I mean, I've done in my career somewhere between, I don't know, 600 and 1,000. Like, I don't keep track, but I just know how many I do a year, and it's like I kind of add up. And like, I've done a ton of these, and I've had one patient that got a little squirrely on me that did fine, and she's totally fine, no problems. But I mean, the overwhelming majority just do great. So you like wonder, okay, what happened? Well, going back to the narcotic medication, I mean, it still could be that. As I like to say all the time, you probably heard me say this, common things are common. And if you give people a bunch of narcotics and they stop breathing, it is logical to think that maybe it was the narcotics that did it. And so, again, we stated that that dose is not too high, but there is one other thing that you have to consider, is basically this patient was in the OR, was being treated by an anesthesiologist and then handed off to a PACU nurse. Now, if the anesthesiologist, as she was waking up, if she was having pain and they gave her, say, a couple milligrams of Dilaudid, which is a longer acting medication, fentanyl's very short, Dilaudid lasts a lot longer. Say they gave her 2 milligrams of Dilaudid and 200 micrograms of fentanyl right when she came out, and then she rolled into PACU and she kind of woke up, and then they gave her another high dose. I mean, it is possible that there was a stacking effect of those narcotics, and that's what did it. It doesn't have to be necessarily enough narcotic that it just straight up kills her. If her respiratory drive goes down and she, say, has sleep apnea, which is very, very common, especially in people who are not super, super thin, and she wasn't like, obese or anything, but she wasn't rail thin either. She very well could have had apnea. The combination of those narcotics could have aggravated her apnea, and then they weren't able to oxygenate her, and then she gets a brain injury, and then all of this is explained. But I don't know. I think that's probably the most likely explanation, because it's like, okay, what else could it be? Well, the other thing that I initially thought is, hey, maybe Mommy Makeover included a Brazilian butt lift and she had a fat embolism. We know she had liposuction, and it is not uncommon that when people harvest fat that they'll do a Brazilian butt lift. Yeah,
and like if she did multiple, if this was her first like surgery, or like what if she started out with getting all these things instead of just doing the tummy tuck or any of that?
Yeah, I mean, there definitely is a lot of data out there to show that as you increase procedures, risks go up.
Yeah.
It's why I typically will only do 2 procedures on a patient at a time. I won't do the multiple 3 and 4 surgeries at a time. It's just too risky to me.
Yeah. That's where my
and we don't know.
prediction or curiosity goes.
I agree with
was
you,
there
100%.
multiple?
I want to know what she had done, because it does give you more clues as to what may have happened. Because if, for example, they said, oh yeah, she had a tummy tuck, lipo, and a Brazilian butt lift, I would put my money on she had a fat embolism. But we don't know that. The other thing that it could be, which is really rare but is a possibility, is that we know she had liposuction, and a rare complication of liposuction is if that cannula, which is the hollow rod which you're sucking the fat out with, gets too deep, it can cause injury intra-abdominally. She could have had a small injury to, say, the mesentery, which is the fat in the blood vessels which supply the intestines, or maybe she had like a small injury to her liver and she was losing blood. And as you lose blood, your blood pressure starts to drop as the volume decreases.
Yeah.
And then they gave her this narcotic, which also causes your blood pressure to drop.
Oh, goodness.
And it could have been a combination of that.
Yeah.
And that would be totally different, because as it stands now, you know, I mean, it sounds like it was a narcotic issue and not anything to do with her surgery, which means she could have had, you know, a mole removal and the same thing could have happened, right? And so I think that's, you know, it is important to make that distinction. Like, is this a surgery problem or is this a,
Right.
you know, a medication problem?
Yeah.
Yeah, I don't really know what the answer is here, although I can make some speculations. You know, I think the narcotics probably still is the most likely culprit, unless we find out she had, you know, a bunch of other procedures, most notably Brazilian butt lift. But I do think that the information will come out. I mean,
yeah, when did this happen again? When I
It
saw it, it
happened
said
week-
like it was reported 5 days ago for me.
Yeah, so I was gone last week, and it popped up on my feed like a week ago.
Okay.
So I think it happened.
Probably within the past month.
I think she
then.
went into it did. She
Yeah.
went into surgery like the 27th, I think.
Oh, goodness.
Of February.
Yeah.
But then it was like radio silence for a week, and so like her husband ended up posting like March 6th or 7th, I think, which is and then it took a minute to catch traction, and I saw it like a day or two afterwards.
Yeah.
So this is really, really recent that it happened. But
It's so sad.
yeah, it's terrible. Like, I mean, you just hate somebody. I mean, obviously someone, you know, lost their life, somebody lost their wife, somebody lost their mom. But, you know, and especially when it's something elective. I mean, and that's my whole business is doing elective surgery. But I mean, that's, you know, why we, you know, try to figure out what these risks are and try to mitigate them to keep things like this to a minimum. And
Yeah.
at this point, you just can't say what happened. Anybody who says, I know for sure what happened to her is just full of it.
Yeah.
I mean, they don't know. I mean, you can speculate, and you know, some people will speculate wrong, some will speculate right, but until you get more information, you just don't know. But definitely a sad story, and something definitely we will kind of keep track of. Again, you know, not sensationalize it, but you know, you like to be informed. Like, what happened to this person? How do we prevent that from happening again?
Totally.